Thank you for joining us again on TVC News. All right, let's turn our attention now to the state of the healthcare system in Nigeria. And the problem has been called brain drain, which is affecting not just the health sector, but various other sectors in Nigeria. But it's been a recurrent issue. And according to the president of the Association of Resident Doctors, Rahman Olayinka, about 5 to 10 members leave the country on a weekly basis seeking greener pastures, and he also noted that what they need is improved welfare packages as well as good working environment and a proper healthcare system, including robust insurance covers for families of resident doctors. And the association is now calling for an overhaul of the healthcare system in the country.
It was a conference which marks the opening of the annual general meeting of the Medical Guild Lagos. The doctors did not pretend about selling the challenges confronting their effectiveness. Top amongst them is the migration of their colleagues under the brain drain challenge, popularly coined the Japa syndrome. The doctors say pressure from the situation is drastically affecting their health.
In fact, it's so bad that even when doctors retire, they cannot retire. They are still needed. They are still redrafted back into the service, because if they are not brought back, there's nobody else to do it. Within a space of 5 days, this association lost 3 consecutive doctors in one center. So you can only best imagine what is happening all around. We have lost not less than 15 doctors over a period of 6 months.
The Medical Guild Lagos is also emphasizing that if the improvement of the nation's economy and infrastructure are made the sole subject of cardinal focus, who will use the infrastructure being given priority by the government if doctors keep dying and their patients dying too? Jacqueline Ogo, TVC News, Lagos.
Joining us now in the studio is medical consultant. He is also the Chief Medical Director of Heritage Men's Clinic, Dr. Rashid Abasi. Thank you for joining us again.
Thank you.
And this is, definitely not a good time for the health sector in Nigeria. So many problem after problem. But what are your thoughts really on this call for an overhaul of the system?
I actually think it's long overdue. I mean, the whole idea about brain drain, it's the brain drain itself is a symptom. It's a symptom of a larger problem. And the problem to me, if you break it down at the cellular level, is abandonment of the healthcare sector. This is a sector that their curriculum has not changed in decades. So when we're talking about resident doctors, we need to take steps back. Back in the 80s, Nigeria, we had a lot of good doctors, a lot of good hospitals. Saudi Arabia healthcare system was developed by Nigerian doctors. Wow. These doctors left. Those were the first Japa people. There was a vacuum created. Nobody filled that vacuum. And that led to poor production of doctors.
All right, Dr. Abasi, let me just quickly put you on a hold. Our apologies. We'll take a break and continue. Please stay with us. Thanks a lot for joining us again on TVC Breakfast. And we earlier on, played a report showing you the dire situation before the health sector in Nigeria. And we have joining us in the studio medical consultant, Chief Medical Director of Heritage Men's Clinic, Dr. Rashid Abasi, to speak to, some of these pertinent issues and how best to restore the situation for the good of everyone. But, in your opinion and from what you've seen on ground, what exactly is the problem, pervading the health system, Japa, brain drain, and what is fueling this, in your opinion?
So if you look at the old Japa syndrome, the brain drain itself, it's actually a symptom of a larger picture. In my own opinion, and being, I grew up in Nigeria, I've been practicing over there for decades now, the healthcare system in Nigeria has been totally abandoned. And when you're talking about investment, it's been non-existent. But let's take a step back. In the 80s, Nigerian doctors were very good. We had people coming from all over West Africa for healthcare here. And our doctors started migrating. That was the first set of Japa people. They left to develop Saudi Arabia healthcare system. That vacuum is still left. Nobody filled that vacuum. So we lost a lot of credible, well-qualified doctors. No vacuum. Nobody is there to train the new doctors. But what the resident doctors are actually advocating for are more like another band-aid on the old issue. They want better welfare. Everybody needs that. Because talent will go where talent is appreciated. So all the Nigerian doctors that are leaving, they're not going for less pay. They're going for better security. They're going for good education. So a lot of the Nigerian doctors that are going, they're just looking for better. So if Nigerian government can invest and make it better here, there is still room to actually put a stopgap on this. But if we're not, it's going to continue.
Well, some will say that people still move from some of these developed countries. I think medical system in Cuba is it some other countries too. They're very sound, and you find Indian doctors there, you find a Pakistani, you find all of them moving all about. So that it's not exactly about whether the Nigerian medical system, the healthcare system is not really top-notch. That's the reason why people are moving. But are there examples of those countries or countries that have effectively tackled this, brain drain happening in their own, everywhere?
So even in the US, we don't have enough doctors. So when we look at that, we have 125 medical schools in the US. They can only produce 17,000 doctors. Their own system that is data-driven says they need 24,000. So healthcare education, medical education itself is long. It's very costly. So the government is stepping in. They've not been able to achieve 100%, but they're getting better. So what these other countries, because they use the US system as the apex, that's the standard everybody wants to join. But we're not ready to invest as much as the US has done.
So that's basically what the government over there is doing, investment.
Investment. And they're not only doing it just from the government alone. The private sector is heavily involved. So for me, in Nigeria, we have the Healthcare Federation of Nigeria. They're a very perfect body that can help. We have the Healthcare Alliance in Nigeria. They can help. These are NGOs that have been brought together to come and augment and help whatever the government is doing. Because it will be laughing at each other if we expect the government alone to do it. It's not. It's never been done successfully anywhere in the world. It has to be an hybrid, the government and the private sector.
But, a very worrying dimension to this is the impact on patients.
Absolutely, yes.
In Luth, for example, the Lagos University Teaching Hospital, a federal institution, here in Lagos, we're hearing of wards being shut down as a result of no medical personnel, no doctors to help the patients. What are your thoughts on, the impact, the implication of this, not just on even the doctors, the practitioners themselves, but even on, regular persons? So
that's actually an example of where the system has broken down. But the system has been breaking down gradually over years. So let me give you an example in Washington, D.C. You have a system in Washington, D.C. where if you call 911 from 10-mile radius, they're not going to direct you to 20-mile hospital. That's a system that works because they know the hospital that has an available bed. We don't have that in Lagos. And that was able to be done in D.C. by private sectors, not the government. Because the private sectors know the value of the human resources. The way we are treating our healthcare system and our resident doctors is like we don't appreciate the most valuable, and that's the human resource.
Well, Nigeria actually spends a lot to train our medical doctors, and then at the end of the day, you find them, shortchanging the country. So some people had already said, especially the former Minister of Labour, yes. When they seek the green on the other side. But what impact does this, bringing have on medical education and training programs within the country? Because of course, we've got one of the best training institutions, yes. If I'm correct.
Absolutely. And I mean, the data tells us, if you go back and look at Nigerians back in the 70s and 80s, our doctors are recognized anywhere. We're having a different explanation now because I'm involved in medical education in the US. Our quality of doctors is being affected, but let's put that aside. If we actually do the right thing here in terms of our own education, so Nigerian medical education in Nigeria, our curriculum has not changed for 2 decades. So whether we like it or not, the brain drain is going to be something of the past. We're not going to be looking at the quality of the doctors. And then because of the brain drain, we're left with short doctors. Every health sector, every hospital you go, they're overwhelmed with all these patients.
I need to understand that.
Yes.
You said our doctors are recognized anywhere in the world.
Yes.
Doctors that are produced.
That are produced back in the 70s and 80s. And it's not the case anymore now.
Okay. Carry on.
And even before you carry on now, what options do these doctors who leave Nigeria, now that you've identified that there is something wrong with even their standard of training, so what's left for them over there?
I can tell you for free that over 28% of the last set of Nigerians that went to the US did not make the board exam. Okay. So what are they doing? They're ending up going to do masters in public health, ending up becoming nurses. That's not their plan. Their original goal is to be able to practice medicine. But here is the issue. The classification in the US and the qualification process is a lot tougher than what we have in Nigeria.
But you can retake the exams.
You can retake the exam. You have a 5-year period to finish like a 4-step exam. Step 1, Step 2, Step 3, and the QS. In Nigeria, you get out of high school and you can get into medical school. It's not like that in the US. I had to have a first degree first. That's for everybody that can go to medical school. When I applied for medical school, 64,000 took the exam. They only accepted 16,000. So you're talking about 25%. So it's a tough place to go, and then it's very expensive over there. My annual tuition a year was $52,000 a year. Wow. So even though people will say, oh, Nigerian government spend a lot of money to do what? The students are still suffering. If you go to Lu today, there are about 20 students to 1 cadaver. In the US, I had 2 students to 1 cadaver, only me and my roommate. And that's where the investment comes in. And I believe strongly that the government alone cannot do it. You need the private sector to come in. Healthcare Federation is appropriate. Healthcare Alliance is appropriate. These are NGOs that can come in. And they're funded by, they have all the stakeholders. So they can bring the pharmaceutical, they can bring the residents association, they can bring the retired doctors, they can bring the academia. And everybody, stakeholders will be able to talk.
In your opinion,
yes,
how collaborative do you think these efforts between the partnership between the government and the private sector and even the resident doctors should be in ensuring that they address this scourge of brain drain? Because we've always talked about PPP arrangements, yes, but it does appear that we're not seeing the result. Is it happening anyway?
In my opinion, it's not happening, and well, I'm not at the table with them, but they need to be 5 and 6. It cannot be done without the other. We just need to believe that, because there is a belief that most Nigerians think is only the government's job. Yes, we have all the resources. What I think the government should do is show us you believe in healthcare as one of your priorities and invest. Let the budget reflect that. When the budget reflects that, then you can now bring the private sector to come and play.
And is the budget reflecting that from what you see? And then you also speak about, you're stressing on the involvement of the public sector, some form of private investment, but then this is business. Is this something that you would pump your resources into if you had the means to?
Let me give you an example. So I've been in US and I've been coming to Nigeria now for the past 5 years, every 2 weeks. I brought all my money, I brought all my investment to come and open here. It's time for me to expand because, yes, I see a lot of patients. I've been looking for funds. 2 banks offered me money, but they're asking me for 27, 28% interest rate. That's not sustainable. There's no way I can do that. As much as I need the money, there's no way. So if the government believes in revamping the healthcare system, the government can step in. They did that for all our churches and all our mosques. They make them tax-free. You can cap the interest rate for private investment in healthcare. And before you know it, that will reflect into academia. The resident doctors will get better treatment because the private sector will be a major player.
But it looks like this thing is also a mindset thing. People already believe that, yes, there is nothing you can do successfully in this country due to so many factors, from when you're born to when you go to school, the harrowing experience of having to, pay through your noses and facing different challenges. But if we don't reorientate our values, how do you think, no matter what the government does, even in investment and all of that, do you think people would have a rethink about what their country is going to be at the end of the day? Because some people already believe that, no, Nigeria is never going to work again.
That's a good point, because it's just people look at it and they look at the politicians and everybody wants to point. And we're not taking a step back and say, what can we do differently? And that's where we're losing. And that's actually what we need. We need a reorientation, whether you call it restructuring or not, but we need to reprioritize our values. So if we want to say healthcare is one, we need to have a different mindset. It's not possible for the government to pay all your healthcare bills or all my healthcare bills. It's not possible. There's never been anywhere in the world where that is going to be sustainable. So we need the private sector. But the government has the leverage. We all pay taxes. And the country is rich in abundant resources. So the government has a way to put it out in terms of their budget. Just increase it a little bit. Invest in this.
When you say rich in abundant resources, yes, we always talk about the limestone, the gemstone, all of this, how does that relate to how does that relate to the health sector?
Good. Our most prized resource is our human resource. So we're talking about brain drain. If we don't do something, this will get worse. I mean, the resident doctors are saying we lost 15 doctors in a span of 6 months. It's going to get worse. They don't even have the data to back everything. They're only telling you the ones that register with them. What about the other doctors? I see chief medical doctors talking to me about coming to the US. They are not part of the resident doctors. So we need a data-driven situation. We need a change in mindset. If not, it's going to get to the point you and I will go to LASUCOM, there will be nobody to see us. We've already been saying that.
All right, so some of the options before us now, there's been talk that fresh graduates should not be made to travel out, you know, seeking greener pastures, so to speak. They should spend the first 5 years in Nigeria. There's also this call of retired healthcare professionals, you know, coming on board to try and cover this shortfall. How far do you think this will go? And is there even a place for that? Should we be talking about that now?
So let's look at the first option, which is trying to punish graduates from going abroad. That's punitive.
So that's the word. It's punishment.
It's punishment. That's punitive. Saying we're going to ban you not to go 5 years and all that, that's not going to work. So you're talking about Nigerians in diaspora. We have tons of doctors in diaspora willing to come home. And what do we need to do? Nigeria spends excess of $2 billion on medical tourism. None of these medical tourism are going for primary care. They're going for specialized care. So we need to find a way to get this back rather than punishing our graduates. If we make it better here, we're going to get more graduates, and they'll have reasons to actually stay here.
All right. Dr. Rashid Abasi, we have come to the end of this conversation, but we know this is a recurrent issue. We only hope that the next time we bring you, we'll have some more palatable news to discuss. The Chief Medical Director, Heritage Men's Clinic. Thank you, sir.
Thank you so much for having me.
Dr. Abasi.